To IsisParenting's Breastfeeding Chat and Learn. Today we are going to be talking about a topic relevant to just about any nursing or pumping mom, because everybody does get sick at some point or another, and that's what we're talking about today. This week we're talking about when moms are ill and breastfeeding. Next week we're going to talk about when babies are sick and breastfeeding relationship there. Okay, so some of you know that I am Nancy Holtzman. You probably guessed that by looking at the slide. I am a mom and baby nurse educator, board-certified lactation consultant, board-certified in pediatrics, mom of 2 young adults. I'm on Twitter, so please follow me there. ISIS is on Twitter, and our Facebook page as well, our live links. You can click on that and like us on Facebook. And let's get started. So I know, unfortunately, that you will have to put this info to use. So there's really no point in saying, I hope you won't have to use it. On average, particularly for young children, I usually say that infants and toddlers will get, on average, 5 or 6 viral illnesses a year. And typically, they may not have their first illness until they're 6 months old, 3 to 6 months old. And it takes babies and toddlers longer to shake your commonplace virus than it does for an adult to shake a virus. So your children are unfortunately going to be ill. It will feel like they are sick 50% of the time, because they'll just be getting over a virus, and then they'll have a few days where maybe they're in tip-top shape, and then they're going to start coming down with something else. But for moms, typically, we don't typically get sick as frequently as young children do. But you will get sick, and particularly when you're starting to spend time around childcare environments, play groups, the shopping mall and the supermarket. That's where you encounter your viral illnesses. And of course, right now that we're recording this event, it is mid-January, and it is the beginning of a peak flu season. So lots of people are sick, and there's 2 major illnesses that are sweeping the country. One is the regular flu, influenza, and the other is a norovirus, which is a GI bug, and sometimes that's pretty famous for the cruise ship, the cruise ship GI illness. So today we're going to talk about these common types of illnesses, like your basic cold, a head cold with congestion or a cough. We'll talk about the flu, which is a lot worse than a bad cold. We'll talk about the GI stuff, the norovirus or rotavirus versus your run-of-the-mill GI bug versus food poisoning, and then mastitis, which unfortunately is another fairly common illness that nursing or pumping moms do encounter. And these are the frequently asked questions that we're going to talk about. So I'll just hit on them one by one. Of course, what most people ask initially is, I'm sick, I have fill in the blank, can I still breastfeed? And pretty much 100% of the time, well, I should say 99.9% of the time, the answer is yes, you should still breastfeed. The 1% might be things like active tuberculosis, chicken pox during the time of birth and during the first week, and then active HIV. That's another and very complex situation in terms of whether or not women with active HIV should breastfeed or not in developed countries. Okay, but we're just going to focus on common everyday illnesses today. So in general, whether you've got a stomach bug or a cold or even the flu, yes, you can still breastfeed, because your child, your baby, has already been exposed to the virus. Both you and your child are exposed to the virus at least 2 to 4 days before you develop symptoms. So before you know you're getting sick, your body is already fighting and losing the battle with the viral invasion. And even when there are some bacterial infections, like a pneumonia that settles into the lung, or a mastitis that can be inflammatory or can be bacterial. If it's a bacterial mastitis, even so, the milk is okay for the baby to take. You've exposed the baby to the illness just through your breathing, through your coughs and sneezes, through your hands, and through your milk. So please now deliver the antibodies through your milk. That's really the best thing you can do. Will baby get sick? It's hard to know. Maybe yes, maybe no. And certainly it's been well documented that in families, particularly families where there's an older child, who might be in childcare or preschool or something like that, who's getting sick from school, and they bring home a cough or a cold or a bug that runs through the family, it's often the infection. The milk itself is okay to feed to the baby. Sometimes as a mastitis clears, you may actually see mucus or a little drop of blood in the milk. Sometimes I call that a floater, because the mucus, like a strand of mucus, will kind of float to the top. You can fish it out or you can decant the milk, but truly the milk is safe to use. If a mastitis is so severe that it's so painful to breastfeed, then you could choose to breastfeed on the other side, but you would still need to express milk from the affected breast. Stomach bugs and food poisoning. Most important here is excellent hand washing and hard surface disinfection. So these produce the same symptoms, a stomach bug, a norovirus, and food poisoning. You'll have nausea, vomiting, diarrhea, and potentially dehydration. With a viral illness like a stomach GI bug, you also may have a fever. Typically, you don't have a fever so much with food poisoning. Food poisoning is pretty much contained to your GI tract. A stomach bug is a virus that, particularly norovirus, we know is highly contagious. So you really do want to pay attention to your hard surfaces as well. Spraying down the bathroom with Lysol, really doing good hand washing, not sharing towels and things like that. But in terms of the breastfeeding itself, yes, you can breastfeed. Now, what about cold sores? I'll take these one by one. Cold sores, herpes, lesions, chickenpox, and shingles. So a cold sore on your mouth or your lips, you can breastfeed, but don't kiss your baby anywhere near the face, really. And herpes lesions should be covered. So actually, unfortunately, the breast is a common place for people to get herpes lesions. And you really do want to make sure that the baby is not in contact with any of the weepy fluid from there. So they should be covered with gauze. If the herpes lesion is on the nipple or areola, if you're not able to cover that sufficiently, then no, you shouldn't breastfeed on that particular breast, but you will need to express milk and discard the milk until the herpes lesion is healed or able to be covered. But in general, herpes lesions on your body or on your breast that can be covered do not preclude breastfeeding. Chickenpox and shingles, again, you don't want open weeping wounds to encounter the baby skin, but you can breastfeed with chickenpox or shingles. Typically, a baby under 1 year is not going to have the vaccination to that. If you have chickenpox or shingles during pregnancy and during labor and delivery, sometimes they do actually want to keep the mom and baby apart for the first week. That's, again, another bigger topic that I'm not going to focus on today. But what we are going to talk about today are these obnoxious symptoms of an illness: a fever, a cough, a congestion situation where your head feels like you just want to cut it off and discard it, vomiting and diarrhea, which of course can lead to dehydration and is of great concern when you are both trying to breastfeed a baby, but also just trying to take care of a baby, and then the usual aches and pains of having something like the flu or a cold. These two things, I couldn't find any picture of someone using a neti pot that wasn't absolutely disgusting and ridiculous. I have to say that up to 2 years ago, I was a neti pot virgin, and I was very intimidated and laughed about it, and never would have thought that I would become a neti pot convert. But I can assure you that I am a neti pot convert, and if you are a medical geek like I am, and you're interested in all of the inner workings of the body, you probably will be secretly fascinated by the workings of the neti pot as well. If you are not familiar with what this is, it is a sinus rinse, or you could call it a nasal douche for fun. And it's kind of like a very small teapot, and you mix a little provided salt in there to make a balanced saline solution. And then you tilt your head over the sink, and you pour the fluid in one nostril, and then it goes really freaks you out. There's just no way of looking at it and not thinking it's weird. But my goodness, if you have congestion, a head cold, sinus headache, this thing is just amazing. It's just amazing, and it's so cool. Sometimes it's cool to see what comes out. Okay, I better move on. The humidifier is so important, and I can't tell you how many friends I make online by people telling me these long, sordid, detailed sleep situations for their babies. But the baby used to sleep well. The baby's now waking up and crying at night and wants to nurse and this and that. It being winter in the Northeast and the heat is on and the air is dry in the house, one of my first questions is, do you have a humidifier going? And I call this the humidifier sleep cure. When you have a humidifier going in the baby's room, sometimes it's the dry air that's making the baby congested, makes their nose stuffy, can give them a dry cough that wakes them up, and makes them thirstier. You know how your skin is dry and your mouth is dry when you wake up? So just running a humidifier can help you, help your baby too. But if you do have a cold or a congestion, a humidifier can really help, especially if you live in an area where the air is dry. And we're going to talk about all of the different cold, cough, and flu remedies that you can buy in the store. So, medications for nursing moms. For fever, aches, and pains, ibuprofen or acetaminophen. So your Motrin or Advil, Tylenol, and then our friends in the UK call this paracetamol, I believe is the same thing as acetaminophen or Tylenol. Don't take aspirin or aspirin-containing products. In fact, our moderator today, Liz, nice to have you here, Liz, asked me a question over the weekend about Pepto-Bismol, I had to suggest to her that she take something different for indigestion or acid stomach, because Pepto-Bismol contains aspirin as well as an antacid, and we don't want aspirin getting through to a baby. So, aches and pains, and you don't need to be a martyr, and you don't need to worry about taking ibuprofen or Tylenol when you're breastfeeding. Of course, I do come from the medical model, but these are medications that we do give to infants, and maternal dose. A good rule of thumb is if a medication is safe to give to, is used in pediatric use, almost always it's considered safe for a breastfeeding mom. This list here you can come back to, and I included some links later on that you can reference these as well. But I just want to let you know, so for over-the-counter medications, feel comfortable using Advil or Motrin or Tylenol, and if you have a very high fever, you can actually alternate the two. So ibuprofen and acetaminophen are two very different medications with very different actions. You could take, for example, ibuprofen at 2 o'clock, and then Tylenol at 5 o'clock, and then ibuprofen again at 8 o'clock, and then Tylenol at midnight, for example. So you can alternate so you get the benefit of both. A cough, there's, in general, you want to avoid things like cough, cold, sinus, achy fever, so you can rest medicines. You don't want to use blended, big combination medicines. It's much better to look at your symptoms and decide what type of medication you need to make yourself comfortable. So don't go for the big catch-all combination medications. You end up taking things that you may not need. It's better just to pick and choose what you do. So if you do have a cough, there are cough medicines that you can take, and different cough medicines have different actions. So, for example, dextromethorphan, which is commonly known as Delsum, or Robitussin DM. DM stands for dextromethorphan. That's called an antitussive, which is the medical speak for something that actually helps suppress a cough, whereas regular Robitussin or Mucinex is guaifenesin, and that's an expectorant. So that helps loosen mucus and helps you cough and spit out the mucus that you're coughing on. So they have two different types of actions. But all of those that I've listed are okay to use according to common resources. Congestion, so if you have a nasal congestion, usually what I recommend is using a humidifier, using saline rinse like the neti pot, and then Afrin nasal spray, which is really effective, can only be used for 3 days maximum, but it really does help clear away congestion. You really want to avoid decongestant tablets. The most common is Sudafed, and that is very drying. The way it works to dry your mucus, it also helps dry your milk. So that might be helpful if you're in the process of weaning abruptly, but that is not helpful if you are nursing or pumping. So stick with the saline rinse and the Afrin nasal spray, and avoid tablets that are decongestants. Now, Benadryl is not a decongestant, it's an antihistamine, so it's not going to help with congestion unless it's allergy related. It is safe to use when breastfeeding, but it will make you sleepy. So I don't have it listed under congestion because it's really an allergy med. Vomiting and diarrhea. You want to basically clear out your system, try to stay hydrated, and this too shall pass. The nice thing about having a norovirus is that typically it lasts about 2, maybe 3 days at the most, whereas flu actually lasts for about a week. So a norovirus is down dirty and downright nasty, but it comes and goes quickly. Flu hangs out a little bit longer, but usually doesn't have as many nasty GI effects. It's usually more respiratory and fever. Compazine, so these medications, Compazine and Phenergen, these are medications for nausea and vomiting. So if you are sick with a GI issue, if you're really uncomfortable, you could use something like Compazine to help with the nausea and the vomiting, but you really, as I said, don't want to stop up the diarrhea. Antibiotics, in making sure and checking and double checking and checking on the very latest research to include in this talk today. The one we used to say that pretty much all antibiotics are pretty much considered safe for breastfeeding, with the exception of tetracycline and so on. And even tetracycline now with short-term use does not preclude breastfeeding. So these are the classes of common antibiotics: penicillin, and again, so you've got ampicillin and amoxicillin, and a lot of medications fall under that class. And same thing, cephalosporins are things like Keflex and almost all of these antibiotics that you would ever be prescribed, whether for mastitis or a bronchitis or a pneumonia or something like that, are going to be okay. And I listed some of the common ones down here. PCN stands for penicillin type medications. Anytime you're on an antibiotic, I would highly recommend that you add a probiotic to your own intake, and actually give your infant or toddler probiotics as well. Look for something that's got some sort of a lactobacillus in it. And yogurt is good, but yogurt is not enough. The other thing I would say is that some of the yogurts that advertise that they're extra special, like the Activia, because it's got these extra special probiotics, pretty much all yogurt has live probiotics in it. But you can actually go a step further and go to a place like Whole Foods or a high-quality health and nutrition and vitamin store and get good quality probiotics. And then antivirals, and this is relevant right now because Tamiflu is an antiviral, and it is used pseudo off-label. It is actively being used during breastfeeding and during pregnancy now. The thing with an antiviral like Tamiflu is you need to start it as soon as you have flu-like symptoms. So the first day that you feel like you got hit by a truck and your temperature's 103, you need to call your doctor and get a prescription for Tamiflu. It helps lessen the symptoms of the flu. These are resources for you to keep, and these are live links. So the Infant Risk Center is a great resource. There's a phone number when you click through, and you can actually call during working hours, their time, and speak to somebody on the phone at no charge to check a particular medication during pregnancy or during breastfeeding. This LacMed app down here, oh, let me get my pointer. I love using all these little features now. So this little app right here, which is a live link, in fact, I suggest you guys click it so it opens up on your screen. And I have this on my iPhone, so I linked to the page online, I think it's called ToxNet, where you can put in the name of a medication and get information about its use and safety during breastfeeding. But I have it on my iPhone as well, and it's a very helpful app for me, and it's free. The AAP right here, if you click through, that links directly to a page called the Transfer of Medications into Mother's Milk, and a very long list of medications that they have deemed generally recognized as safe for use with nursing moms. This book here is not a live link. You can purchase this book online. It's called Medications in Mother's Milk by Dr. Thomas Hale, and he's actually the guy behind this here too. And this is a book that every lactation consultant has on their desk, and we wish that every physician and every pharmacy had on their desks, but they don't. It comes out every 2 years, so on even years it's updated. And it specifically talks about medication transfer into mother's milk and any potential risks or things to look at. And then these are some live links down here, which basically talk about, they're just articles from the blogs that I've written that talk about all of these lists of medications and topics in a written form if you don't want to access the webinar again. Okay, so there's a question I see about someone that wants to know if we're talking about dealing with sick babies as well or just mom. Today we're talking about when the breastfeeding mom is ill and how to manage that, and next week we're going to talk about when breastfed babies are sick. And if you do need resources for that, let me know. You can email me directly or contact me actually don't email me directly, contact me on Twitter or ask click right now and they'll open up new tabs on your browser. Both of these include information on managing these symptoms, colds, fevers, and then also another article on managing GI symptoms, nausea, vomiting, diarrhea, and hydration issues for infants and toddlers, as well as pregnancy and breastfeeding. So those will be good resources for you for now. Okay, so moms, when you're breastfeeding and you're sick, you have a high fever that helps dehydrate you, and then of course if you add vomiting and diarrhea to it, you're going to get even more dehydrated, and that's going to impact how you feel. When you are dehydrated, that's one of the reasons why you feel dizzy and weak and so sick, and of course it will decrease your milk production too. So you want to manage your fever so that if you can keep it down to a manageable level, 101 instead of 103, that will help a little bit. Take sips of clear liquids, but if you are experiencing dangerous signs of dehydration, if you're dizzy when you stand up, if you feel completely weak, if your pee is dark and infrequent, if you're confused, you probably need to go into the doctor's office or the emergency room and get some IV fluid. And I'm not kidding. I mean, people need to do this. The emergency rooms are full right now with people getting IV fluid. Doesn't necessarily mean you need to be admitted, but if you are so sick that you're vomiting up everything you're putting down, you have a fever and diarrhea, you're going to dehydrate pretty quickly, and it can make you feel really, really bad. This is how you can make homemade rehydration solution at home. It's simple, it's easy, it's cheap, and it's good for babies over 6 months who need rehydration solution, toddlers, kids, and adults. So this is a perfectly fine, balanced rehydration solution that you can make at home. What happens when your milk supply does dip? Try to stay hydrated as best you can. What I call nursing on 3 breasts, and I just love using this picture at any opportunity. What this means is if your baby is cranky because the milk supply is lower, then you may need to switch side to side frequently so that they go to the new side with a little bit of vigor, and use a lot of breast compression, which helps firm up the breast, gets them sucking a little bit more vigorously, and it may facilitate another milk letdown. Monitor your baby's diapers. If your baby is young and is exclusively breast milk fed and isn't drinking from cups and eating solid foods, then you may need to nurse a lot more often than you had been if your supply is down. But do check your baby's diapers. Assuming your baby isn't sick, you want to make sure that, that they're having close to their usual number of wet diapers. For a sick baby, we always want to make sure they're having at least 4 wet diapers in 24 hours to make sure they're hydrated. But if your baby usually has 7 or 8 wet diapers, just keep an eye on the diapers and make sure that your baby seems to be doing okay. And of course, feed the baby. So if your baby is older, you can make up a little bit of the difference by giving them extra solids at their meals or add an extra solid food meal. Most of the foods that we feed young babies have a very high water content. So something like applesauce and sweet potatoes and things like that. They're 80 or 90% water. And if you do have to, if you're so sick that your supply is tanked, or you're just so sick that you can't feed your baby as often, then you might need to be using some of your frozen stash, and you might need to get some help. So hopefully you have a family member or an in-law or somebody that can come and help you with the baby if you're that ill. But somebody can bring the baby to you when you need to nurse, and they can feed the baby solids or bottle feed, and so on. Okay. But when you are feeling better, your supply will come back up, and there may be things that you can do to help encourage that process when you are feeling better. So basically, you need to be nursing and or nursing and pumping. You need to eat and drink, and then repeat those all over again. So one of the picture here, those of you that are regular attendees know that I'm a big fan of I always talk about double pumping, hands-on, hands-free. So mom is using her hands-free bustier so that she can be double pumping while she is keeping her baby happy and busy. So whether your baby is 7 months old and sitting up playing like this little fellow looks like, or your baby is 2 months old and is laying in front of you, propped up on a boppy while you dangle a toy over them, you need to be pumping both breasts at the same time, and having your hands free so that you can massage and compress your breasts, and you can also tend to your baby so that you're able to pump. Because, of course, waiting for your baby to be down and asleep so that you can pump is going to be essentially useless. That happens like never. So eating, yes, eating is good. And I'm hungry, so that lunch looks pretty good. Here are 2 live links to additional webinars that will be helpful for you. A long webinar on increasing milk production, and then a fun little webinar that if you're not familiar with some of my tricks for better pumping and things like double pumping, hands-on, hands-free, and what else do I have? Oh, mastitis. So, yeah, let me just say a couple words about mastitis, and I do have a full mastitis webinar that actually talks about engorgement, blocked ducts, clogged nipple pores, and mastitis. They are all kind of interrelated. But with mastitis, you may feel like you have the flu. So the sore breast may not be the primary or the initial symptom. You may feel like you have a headache and feel run down, and then feel feverish, and then feel nauseous, and really feel like you have the flu. And oh yeah, by the way, your breast hurts too. But anytime there is a fever plus a sore breast, pretty much think mastitis. And mastitis you would treat just like a blocked duct. and add antibiotics as well. So you use heat before nursing or pumping, sometimes use ice or a cold pack after. You want to try to lay low and recuperate as best you can, nurse or pump very frequently, gentle massage to try to clear a blockage if there is one, ibuprofen around the clock as an anti-inflammatory, also for comfort and fever. But yes, add the antibiotic. And then, of course, we talked about anytime you add an antibiotic, add probiotics for you and the baby. And let's stay healthy. So I hope everybody got their flu shot. Again, I do come from the medical model, and you know, I know that the flu shot is only perhaps 60% effective to the strains of flus that are around there, but 60% is more than 0% effective. And it also may be true that if you do have the flu shot and you still get sick, you're going to have a much milder version. So that's beneficial as well. And avoid, I mean, a lot of these I think are obvious, but I just got to say them. Try to avoid sick people. Here I got a picture of, you know, coworker who's got her tissues all over the place. And you want to be cognizant of what your hands are touching. I put this picture here. I get extra credit if anybody knows who this is standing next to the ATM machine. It's not a very close-up picture, so I doubt anybody will get it. And when I know who it is, but I don't actually know who she is. I know her name and I know she's famous, but I don't know her movies and shows. I know what she's in. I just don't know her. I'm just not hip enough, I guess. But, you know, ATM keypads are pretty much the most disgusting germ-infested thing out there. Plus door handles and the paying for something at the store. These are all places that you touch. And imagine if everybody walked around with their hands dipped in wet paint. Everything you touch, you're leaving wet paint on, and the next person that touches that thing is getting that wet paint on. So it would be easy to see the germs spread if germs look like wet paint, but they don't. ATM keypads are never, ever, ever, ever cleaned, and they're inside, so they don't even get rained on. So something like a shopping cart handle, at least it goes outside and sometimes gets rained on. But door handles and ATM keypads and you know, public computers and anything you touch. Don't touch your face afterwards. You have germs on your hands, and as soon as you touch your eyes, your nose, or your mouth, your mucous membranes, you're putting those germs in there. So somebody made a joke online this week, because I was saying, you know, Purell, this is one of my favorite things, blah, 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 alcohol-based hand sanitizer. And she said, if you don't have access to Purell, just go visit Nancy at ISIS, because I do have kind of a Purell collection at my desk. Using hand sanitizer, it's not the same thing as using antibiotics all the time or using antibacterial, you know, soaps and products everywhere. The germs are everywhere. You're going to encounter them everywhere. A lot of the germs are droplet spray, meaning, you know, somebody coughs or sneezes or just breathes hard and you breathe it in and get sick. You know, you've got to keep Purell in your diaper bag, in your stroller console, in the console of your car, on your coffee table, and, you know, anytime you think of it, a little squirt of Purell to your hands. We don't put Purell on babies' hands. It does evaporate quickly, but you need to rub your hands together briskly to make it work, and then it air dries. And we know, of course, babies keep their hands closed, curled, or fisted, and they like to put their hands in their mouth. So no. But if you're out at the store, you don't have access to a soap and water in the middle of the store, so you might as well use your hand sanitizer. Foods like vitamin C and zinc and probiotics are known to potentially help reduce the likelihood of a severe illness, but special products, a lot of people will ask me about airborne or I can't remember what it was called, some special vitamin C concoction. All of those things are essentially very, very expensive vitamin pills. So if you take a daily vitamin pill and you eat some vitamin C every day, you don't need any fancy types of vitamin or all-natural immune boosters. Okay, I think we'll wrap that up. Next week, we're going to talk about when babies get sick. And as I said, I'll go back to these links here. If you missed them the first time, right there. So you can open those up, because if you do want info on when babies get sick right now, these bottom two links have that info for you. And of course, I'll post this webinar later today in an hour or 2 or 3 so that you can access it again later or share it with your friends, which of course I would appreciate greatly, because we're always trying to boost attendance at these so that I can prove to the ISIS folks that I work with that dedicating time and finances to these webinars is beneficial. Okay, 2 questions. I'm going to answer them and then we'll wrap up. Some mom says, I get horrific menstrual-related migraines. I am seeing my primary care provider next month and will ask about taking something, but what are your thoughts on what is safe? Okay, so I just have to look at individual medications, because I don't know, I don't actually know currently what's cool, new and hip that they're using to treat migraines. Is it some kind of a vasodilator that opens blood vessels in the head a little bit? That I would look it up specifically, but that would probably be safe, because we use vasodilators commonly for a variety of reasons in breastfeeding women. Is it a pain killer? I know who this mom is. I know her babies are well over a year old, and so if it's something like Tylenol with codeine or something like that, yes, that too is safe. So we just have to let me know what they want to use, and we'll look it up and make our best information. One thing I didn't mention when we were talking about meds that I meant to is that almost always, sadly, you will get an off-the-cuff comment from a physician or a pharmacist who is not as familiar with working with breastfeeding women, and they will just say, oh, you can't breastfeed when you're on this, or oh, pump and dump for X number of days, and very often for reasons of liability, many medications, it's very difficult to test a medication on a pregnant mom or on a breastfeeding mom. So a lot of times there'll be medications where it says, no information is available. And that doesn't mean that we can't extrapolate other information, like the molecular weight of the medication. Is it structurally similar in action and in chemical makeup to another medication that we do know more about, and so on. So just because somebody says, oh, you can't use this medication while you're breastfeeding, you'll have to wean or you'll have to pump and dump, does not actually mean that recommendation is based in science. And that's why doing your research to those resources I shared with you earlier is important. I swear to you that 50% of the time I'm asked about a medication, a mom contacts me to ask for help with emergency weaning, and I look up the medication, and it's on the American Academy of Pediatrics list of generally recognized as safe, approved for breastfeeding women. There's some medications that would be used with caution during a baby's first month, because babies have immature livers and may not metabolize a medication as well. But for a mom that's breastfeeding a 5-month-old or a 10-month-old, it's going to be a non-issue. There are some medications like antibiotics or antivirals, which have one action when you're taking it orally as a medication, and then if you're using an eye drop or something like that, it's a completely different issue. So don't always, if you're given advice that you can't breastfeed or that you need to pump and dump, don't always take that as the God-given truth. You need to do more research. It may be true, certain chemotherapy, of course, and so on, but I wouldn't take a casual. Another common scenario is a mom that needs surgery, and she's told, that she needs to pump and dump for 24 or 48 hours after anesthesia, or while she's on pain meds, and so on. And almost always, that's actually incorrect information. Okay, I know it's recommended that breastfeeding moms get a flu shot. Are the antibodies created by the mom from the flu shot passed on to the baby? Can any of the preservatives in the flu vaccine be passed to the baby? Okay, great question. I advise all nursing moms to get potentially protecting yourself from the severe flu outweighs the other concerns. Some flu shots are available in single dose rather than multi-dose, so they have lower preservative and yes, the antibodies can be passed through, which is why pregnant women really are urged to get the flu shot, because she will help protect her baby, particularly during those first few months as well. Question: are zinc tablets, coldies, etc., safe to use? Yes. And do I recommend a multivitamin for babies? Mine is 2.5 months. I will defer to your pediatrician on that. Most pediatricians do recommend either polyvisol, trivisol with vitamin D, or just vitamin D drops. In general, no, a breastfed baby doesn't really need additional vitamins, with the exception of vitamin D, perhaps. That's a whole other controversy right there. We can do another week on that topic. But right now, it is recommended that all breastfed babies do receive a vitamin D supplement, and usually, rather than just prescribing to you vitamin D, they usually combine it with a multivitamin. Okay, we got to wrap up. It's 12:42 here in Boston. I really appreciate everybody coming this week. I hope you come back next week. Next week, we're going to talk about breastfeeding when a baby is sick. What happens when your baby has diarrhea or is vomiting. Sometimes a pediatrician's office will say stop breastfeeding or stop bottles and give Pedialyte and so on. And actually, breast milk is the best hydration fluid. You can give Pedialyte on top of that if you want to, but it's actually not necessary. And things like the humidifier, clearing the baby's nose using saline and a nose frida, or saline and a nasal aspirator before eating and before sleeping will help keep the baby comfortable. We'll talk about my sneaky tricks, like using the Feverol acetaminophen suppositories, which is a really great way to medicate a baby who's vomiting or sleepy, and so on. There you have it. So listen, everybody, have a fabulous week. Join me next Tuesday for our sleep webinar with Meg Casano, and our topic next Tuesday is going to be one that people seem very excited about. We're going to talk about managing the dreaded short nap, or the nap pop-up. So when your baby only sleeps for a 20 or 40-minute cycle and then wakes up from their nap, how can you actually help your baby over, say, 5 months or so, get into a better nap routine where they actually are napping for 45 minutes to 2 hours. So we'll talk about nap pop-ups. Everybody, have a great week. Meg will be here next Tuesday with me. Liz, thank you so much for your help. I hope everybody stays healthy this week. Remember to be wise, immunize, and sanitize. How about that? And I'll check the chat to see what links and other things I might need to post in here for you. Okay, I'm going to shut my mic off. Thanks, everyone.